Thank you for tuning in. For release on Wednesday, November 25th, 2020, this is a special broadcast. Before we get too far along, I want to pause for a brief commercial by the United States Space Force.
Today, space is essential not only to our way of life, it's absolutely critical to the modern way of war. GPS, ATMs, cell phones, gas pumps, traffic lights, power grids, guided missiles, surveillance, RPAs, ground combat control. There's no such thing as a day without space operations. You just don't see them. Earth is only half the battle. Cyber attacks and jamming of our satellites. Microsatellites that can create a debris field. At 17,000 miles an hour, a piece of metal the size of a coin can be weaponized. Now is the time for a military branch with a clear and singular focus on space. A military branch that protects the hopes and dreams of America and our way of life as the space domain becomes more and more contested. It's time for another giant leap. The United States Space Force is being built from the brightest minds across the space operations of the Air Force, our joint services, and the private sector. We aren't just getting ready for the near future, we're getting ready for the 22nd century. When our enemies ask, what if? We will have an answer. When foreign powers can build bases on the dark side of the moon, when private companies are inventing a new economy beyond our planet, we need to stay one step ahead of the future. And the future is where we'll make history. We will fight in an environment with no up or down, no left or right, where there are no borders and nowhere to hide. Our Space Force is defending our country, here on Earth and wherever our mission takes us. As commerce and exploration expand, we will imagine the unimaginable, anticipate the inconceivable, and prepare for the impossible. We won't just think outside the box. We'll think outside the atmosphere, in one of the most challenging environments ever known.
All right. Now the service, that is to say the U.S. Space Force, it's just reached its first anniversary. Now as you can see, I've written 2 short stories that are available on Amazon. That's Space Force, An Alternative Origin, and Catawba, Flavored Lost. And those are available in print and Amazon Kindle formats. And they're not true tales, but they are fiction. They are inspired by. Let's hope that the new service can get a long and healthy history behind it. I am in fact working on a 3rd story now, about halfway there. Now, shameless commerce aside, the main reason for this special broadcast is to discuss the data released by the state of Ohio relative to the coronavirus crisis. Due to the Thanksgiving holiday, the updates to the Ohio Public Health Advisory System and its map were released early today. Now the new data, it's fairly disturbing. Ashtabula County now meets 5 out of 7 indicators on the map. The areas of concern that we met include new cases per capita, new cases increase, non-congregate cases, emergency department visits, and outpatient visits. The areas of concern that Ashtabula County has not passed trigger thresholds on are hospital admissions and ICU admissions. Now that leaves us at red on the map. For an area to hit purple, You have to run the table, all 7. And you have to be on a continuing collapse on all 7 indicators. Meaning for 2 weeks, it's got to get bad, not just for 1 week, but it has to be continuing bad for 2 weeks. You have to show a continuing decline. Now, Franklin County first hit purple last week. They continue at purple this week. 3 counties advanced to the purple status today. Montgomery, Lorain, and Lake counties did so. Now, in case you have trouble with placing towns in those counties, Dayton is located in Montgomery County. Wright-Patterson Air Force Base, Space Force will be located in part there. And Oberlin is based in Lorain County. And Oberlin College is right there. But to our west is Lake County. That's the very close, much more immediate concern. Now, purple status on the map does not change anything by itself. However, it does indicate that coronavirus is severely spreading in Lake County. It does indicate that the hospitals physically located in Lake County are under severe strain to the point of being overwhelmed. Now, if you feel the need to go out to Lake County to shop on Black Friday, such as at Great Lakes Mall in Mentor, you should strongly reconsider that. Shopping online instead is strongly advised. If you have any reason to visit TriPoint or any other medical facility in Lake County, you should call ahead to see if your appointment is not otherwise changed to telehealth or rescheduled. If you feel the need to visit somebody in Lake County, you're advised strongly to avoid doing that at this time. If you head into Lake County right now, the risk is extreme. The risk from coronavirus is too great. If you head into Lake County, it's not a good idea. As to Trumbull County to our south, they issued a stay-at-home advisory today and also are now on the watch list for going to purple on the Ohio Public Health Advisory System map. Visiting folks in Warren or Cortland is a bad idea right now. If a county is on the watch list to go purple, their hospitals are extremely stressed out as to capacity already. Now, the point of the watch list is they have to show that extreme stress for 2 weeks in a row. They already meet all those criteria for 1 week. The stress has to continue and increase for another week. Will they? We'll find out. I hope they don't. But all signs are not looking pretty. Heading into Thanksgiving, we should all take heed of the current situation. Trumbull is one of 11 counties that were added to the watch list today. Ashtabula remains at red. We're not there yet, but the crisis is getting bad. The coronavirus situation is deteriorating and collapsing at a fairly steady clip, not just statewide, but right here, right in our immediate area. It's getting bad. As we head into Thanksgiving, consider this. If you're heading into Lake County or elsewhere, if you need medical help, it's not there. Heading to Lorain, medical help is not there. Those hospitals are now overrun. The Ohio Hospital Association now has a great daily chart that they're updating showing how stressed are ICUs right now. In southeastern Ohio, 1 out of every 2 ICU beds is occupied by a COVID patient. So every time you see someone online saying, "Oh, the hospitals are empty," just remember one thing. That's a lie. We wouldn't have the Ohio Public Health Advisory System telling you what is happening in our hospitals. The governor wouldn't have leaders from our hospitals on for press conferences once or twice a week if he didn't think it was bad. And they're not all lying. Things are getting bad. Stay safe, be strong, and God bless. Until next time.